So imagine going to bed one night, everything fine, everything pretty much normal, only to wake up the next morning and you find that a disaster has shown itself upon your chest. Yeah, that's pretty much what happened to me. Hey guys, what's up? It is your girl Sabrina and I am back for a update. This is not just a VSG update. This is actually just a medical update, a total health roundabout update. I really have a lot to share with you guys, but as far as VSG is concerned, this is my 4-month update. I had it in October, so October, November, December, January, February. So yeah, 4 months it has been since my gastric sleeve surgery. I had gastric sleeve surgery on October 22nd, 2019, and yeah, February 22nd makes 4 months. But I did want to run down a lot of things that's been going on with me. If you guys do not follow me on Instagram, please follow me over on Instagram, because I do update over there a lot more frequently, you know, because it's a lot easier, it's a lot quicker. I can get the word out a little bit faster than I can. So when I come to YouTube, I pretty much am putting all of those things together and then putting it in a video. But lately I've had some health issues, and I actually wrote them down on my phone. Like, I put them down because I really need to talk to you guys about what's been going on with me. It's just a lot, you know. It's been a lot. It's been a little, you know, tough to deal with. At times it's been very scary. At times it's been very perplexing. Like, I don't know what the hell is going on. Just, you know, bear with me, because this video is going to be a minute, because I really need to cover a lot. So let's get started. So originally, first things first, VSG. Yes, like I said, VSG I had in October 22nd. Okay, let's start with VSG surgery. Let's get the stats out the way. So you guys know that the week before surgery I was 331 pounds. The day of surgery I was 318. And as of right now, I am 258 pounds. And I feel good, you know what I'm saying? I mean, I've lost, that's a lot of weight that I have lost. I am definitely not intaking a whole lot of food. I'm doing like maybe 1,000 calories a day. When I talked to my bariatric surgeon, he basically said, you know, that I'm doing well as far as weight loss is concerned. What I do hate the most is when my cycle comes around, here comes the pounds. Like, it comes back up again, like shoots back up at least 5 to 7 pounds. I don't even get it, you know, because I'm retaining water and all that other stuff. As far as eating, I am doing well with that, as far as digesting food, eating, you know, not everything. The only thing that right now that doesn't really agree with me, you know, is potatoes. Like, I can't really eat potatoes. I can't really take too many of those in. They're so dense and so thick, so I don't eat a lot of potatoes, like french fries or tater tots, anything like that. You know, anything that is potato based, I'm not really a big fan of, unless it's mashed potatoes, because the consistency is so much mushier, which is better for me. Anyway, let's talk about vitamins. The reason why I want to really talk about vitamins right now is because an issue that I'm going to get into later is kind of directly related to my vitamin intake. I had thought I had been taking my vitamins regularly, and I thought I was getting the right amount in. You know, I thought I was doing everything right, but come to find out that I was not getting enough vitamins in. You guys know, if you've been following me, you guys know that I have a severe anemia issue. My anemia, my iron, my hemoglobin is can be very low. If I'm not regularly taking my iron, I take more iron than usual. You know, most people take like maybe 1 a day, 1 iron pill a day. I'm taking 2, maybe 3, just to stay, you know, on top of my iron. But that's an issue as well. But it's important, you guys. It's important. Take your vitamins. Take your vitamins. Take your vitamins. Take your vitamins. The simple fact of stuff that has been happening to me You know, it can't, you know, many of the doctors that I've talked to have said that it can be a result of vitamin deficiency. Yeah, so that is one issue that I really want to really stick to right now, is the vitamin issue. The vitamins is very important. Right now I am taking a multivitamin. I'm taking a multivitamin, I'm taking a calcium, I'm taking vitamin D, I'm taking B6, I'm taking B12, I'm taking my iron, and it's a lot, guys. It is a lot. The thing about it is that if someone tells you that after VSG surgery that you will not need your vitamins, they are bullshitting you. And I'm just gonna say it like that. They're bullshitting you. And for those of us that have a very weak immune system, my immune system is very, very weak. I have to double up on my vitamins now. Now I've realized that's what's keeping me better, or helping me out a little bit more. Oh, my eating habits. My eating habits, like I have been having some tummy pain, some tummy aches, you know, and I wasn't quite sure what it was, whether it was, you know, food related, or whether it was actual surgery, you know, stomach issues or something like that. The doctor told me, you know, it comes with surgery. Sometimes you might have some discomfort, you know. I'm in my early stages of recovery. It's only been 4 months. I have to get used to my stomach. Sometimes it hurts, like it used to hurt every single day, but now lately, and what's really weird is that lately, since I have been doubling up on my vitamins, I haven't been having that much stomach pain. I really haven't. And that might have a lot to do with it as what else, because yeah, I'm looking at these notes because I have a lot to cover. Severe, let's go into the anemia issue again. The anemia issue, I have a severe anemia, and I lose a lot of blood during my cycles, and I lose so much that I am weak, you know, very weak. Like, I don't want to get out of the bed for pretty much for the whole week that my cycle is running. So I can't go anywhere because the blood loss is just massive. And like I said, if you guys follow me, you guys already know this information. You guys know I'm sitting here and I'm suffering through a lot of blood loss and a lot of weakness. I have had a uterine ultrasound done. I've had a pelvic ultrasound done, internal, and the doctor had discovered that I have numerous amounts of uterine fibroids. So that's another thing. Have uterine fibroids. So now doctor has told me that, you know, that is the reason, probably most likely, why I'm having the issues with the heavy periods and the blood loss and things like that. So after contemplating for not very long, because I don't need to have my uterus right now, I mean at all, actually I don't need my uterus anymore. I have had 5 children. I am 46 years of age. I have made a decision to have a hysterectomy. The doctor did give me other options on what I could do. The fact that they could give me medicine, they could medicate, or they could give me IUD or different birth control to control the bleeding, but that wouldn't actually solve the issue of the actual fibroids. So I said, first of all, I've already had a tubal ligation. So after my last child, I got my tubes tied because I wasn't gonna have any more children anyway. I didn't want any more kids at that time. I mean, at all. You know, I was done having. I was finished. Like, I was like, okay, I'm good. I've given birth to 5 children, and now, yeah, I'm done. Hysterectomy. I just told her, I was like, hysterectomy is what I'm leaning toward. This is pretty much where I want to go. I'm tired of the blood. I mean, because the thing about it is, a hysterectomy will solve my issues of the fibroids, and it will solve my issues with having a period every month. That is crippling. Like, the pain is terrible, you know, the blood is ridiculous, you know, I'm ruining sheets, I'm ruining clothes. It's a problem. Right now the plan is to have it around the beginning of April. You know, at first it was March, but me and my gynecologist got together and we discussed it, and yeah, there's a lot of things for me and my family going on in March. So April is gonna be, you know, now the process is that it's not gonna be a surgery where I have to stay overnight. You know, in the past you've had hysterectomies where you've had to stay overnight or at least 2 days in the hospital. My gynecologist told me that this surgery is basically in and out, same day. Come in, she does it laparoscopically, and then I'm out the same day. And usually she says I will be up and about pretty much in about a week or two, which is good. I'm happy about that, and frankly I cannot wait to have this surgery. I seriously cannot wait to have this hysterectomy. Now the thing about it is that it's not going to be a full hysterectomy. It's not going to be where they take out the uterus as well as the ovaries. I will still have my ovaries, which means that I will still, when it's time for me to move in towards menopause, I could still get those symptoms of menopause, you know, flashes, things like that. Anything that comes with, you know, emotional sides or anything like that that has to do with menopause, I could still get those I could still have those symptoms, even though I no longer have a uterus to have periods and things like that. But I am so excited because I'm gonna be so happy, and you guys have no idea. Then again, maybe you do, maybe you've had, you know, maybe it's some of you out there that have had such bad periods, crampy, painful, messy, that, you know, getting rid of your uterus, you know, is godsend. The fact that I have these uterine fibroids, and they're not, you know, cancerous or anything like that, so there was no threat to that. Like I said, yesterday I did have an appointment with her where I had a full pelvic exam where she did take samples of my uterus, so she wants to make sure that there is nothing else wrong with my uterus or anything like that other than the actual fibroid. So I just had that done, so I'll be updating you with that at a later date. So let's move on into what's going on next. Yeah, I went to bed one night, thought everything was okay. I woke up the next morning and my breast looked like this. And then I had no idea what was going on. Like the skin was just completely on. It was like someone had took the peeling off of a grape. That's how thin, like it was the very top layer of skin. It was gone. And the crazy part about it was I had no idea why it happened. I hadn't hurt myself lately. I hadn't bumped into anything. I haven't had any issues with, you know, redness or irritation or anything. It's just the night before everything was fine, and the next morning, boom. I went to the emergency room, and they basically, well, I went to the emergency room at my local hospital, and they basically treated it as though it was like a burn. Initially, they basically gave me some gauze and some Vaseline and told me to apply it and regularly, and then if it changed in some sort of way, or if it started to look worse, this is what they told me. If it started to look worse and it didn't look like it was improving, to go back to the emergency room. So after about a couple of days of me doing that, then it turned out, and then it looked like this. So by that time I was freaking out because the tape they had given me or whatever to put on there, I guess it was breaking out my breast, and then I had that rash that was all the way around my breast, and then it just looked horrible. Like it was really looking nasty. And then as the days went by, it started to look like this, and then it looked like this. And then I was like, okay, fuck it. I'm going back to the emergency room, but not the same one. I went to a different hospital. Went to GW, George Washington University Hospital in Washington, D.C. I love that hospital. Like those are the people that did my BSG. Those are the people, you know, that have done my hernia surgery. They are a really, really great hospital. And truthfully, I should have went to them originally. I went to talk to them, and they basically told me they did a ultrasound, a limited ultrasound on my breast to make sure that it wasn't an ulcer. I mean, that it wasn't a deep tissue ulcer in my breast. When they asked me, you know, what happened, I basically told them what happened. I had the photos. They were very glad that I took the photos so I could show them exactly what was going on. They looked confused. Like, they were like, I had no idea what was going on. I didn't know what was going on, but it was something that actually kind of stumped them because it came out of nowhere. So after a few conversations with different doctors that was in the emergency room, told me that they wanted me to get a scan, a diagnostic ultrasound, because a couple of the doctors were concerned that it could be breast cancer related. That scared me. Like, it really did scare me, because my mother passed from breast cancer in 2007, and she was only 50 years old. And I'm 46. So because I had breast cancer, you know, in my family history, it was an issue for me. And when they did, you know, the breast exam, they thought they might have felt a node or something, and it was weird because I was just like a little nervous, a little scared, but actually I was a lot scared. But yeah, that pretty much, you know, yeah, it was something to take in at the time. And because it popped up out of nowhere, and I'm still, you know, healing right now. They actually referred me to go see the wound care center at GW. They still want me to have that ultrasound, I mean that diagnostic ultrasound, which I haven't had yet because it's been hard to get that appointment for some odd reason. They also wanted me to go back and talk to my primary care physician, and which is so because I can't get the ultrasound. Then I went to make an appointment with my primary care physician, and she won't give me an appointment. I can't get an appointment with her until March 16th. And in order for me to get the diagnostic ultrasound, I have to talk to her first. I might not find out what's really going on, or I might not really find out if there is any kind of cancer in my breast up until after March begins, until after like the second week of March. I wanted to get this information earlier, you know, and for me it is an emergency, and for me it is a press type situation, you know. Hopefully I can go through GW and get the ultrasound, or try to get somebody to, you know, put this on a fast track, because I really need to get that information. But they also told me, because I had a VSG in the last 3 months, that most likely it looks like vitamin deficiency, as related to my skin as well. And my skin is really bad. Like, I have noticed, if I've been working on my skin, you know, if you guys can really see, I know the lighting in my room is not great, but if you guys can see it, you know, my skin, it's really, really bad. I'm trying to focus in. See it? It's really, really bad. Like, it's discolored, and it's just really bad. And the coloring, you know, the pigmentation in my breast, it's changing, you know. I did go to the wound center at GW, and they gave me some stuff. I'm very happy that they gave me some stuff, and they were very, you know, very sweet and very attentive to my issue with my breast. They gave me something called Meta Honey. Let me see if I'm gonna grab it. I'm gonna show you guys what it is. This is it. It's called Meta Honey. I know it's in reverse or whatever. Yeah, it's called Meta Honey, and it's a medical grade honey. and they told me, you know, because of that black necrosis that's going on, that's what that is. The black part that's in that wound is called necrosis. It stopped the healing process, but the Meta Honey helps with the healing process. It helps with removing the necrosis that has set in my wound, that black part, that hard black crusty part that looked like a scab in the middle. The Meta Honey is supposed to clear that up. It has been working. So if you look at this picture, this is the progress right now of how the Meta Honey is helping the entire wound. If you guys can see around the edges, you see that it is starting to pull away, which is good. That's what they wanted to do. So I have to I just went to see the wound center for the first time, and so I have to update with them every single week until, you know, I'm guessing it's completely healed. If you guys have followed, like I said, follow me on Instagram, because I'm always updating when I'm going to the hospital, when I'm going to the doctors. You guys will see it. I will talk to you guys. That is the best place to keep updated really with the day-to-day progress of this wound and what's going on with me, the day-to-day process. Talking to my gynecologist about it, I talked to her because I wasn't sure that if this wound was going to be a reason for my hysterectomy surgery to be canceled, but she said it wasn't. She said it's gonna be fine. She was like, you don't have to worry about, you know, having it, because it's not infected. You know, the wound is not infected, so it's not going to interfere with me having a hysterectomy, which I'm very happy. And since my surgery is not going to be until April, hopefully this wound will pretty much heal up and close up almost by that time, because the Meta Honey works very, very fast. You know, I put this on and I spread it on, and then I just put they gave me pads, and then they gave me these pads to put on, and then I just cover it up, and then I just put on my my sports bra, and I wear it for an entire day, and then I change it every single day. I don't change it more than once a day, but I do put the honey on, so every night I change it, and then I wear it all day the next day. I have squeezed a lot into this little video. I've told you guys pretty much everything that's going on with me. Please do not forget to follow me over on my Instagram over there, you know, so you guys can stay updated with what's going on. Please subscribe to my channel, click that bell so you guys can be notified whenever I upload a video. Also, please check out my Etsy shop, Precious Pots, and if you want to go check out my Instagram for that Etsy shop, it's right here, Precious Pot Shop on Instagram. And with that being said, guys, I hope you guys are enjoying the rest of your day, and I will see you guys in the next video. Peace.